Hello and welcome to MD Newsline. Thank you so much for joining us. Can you please introduce yourselves to our audience?
Go ahead.
My name's Dr. Olivia Wills. I am an accredited practicing dietitian and registered MS nutritionist and dietitian from Australia, as you can probably tell from my accent.
And my name's Karen I'm also an accredited practicing dietitian, known here as an RDN, and I'm also a PhD candidate at the University of Wollongong.
All right, so dietitians aren't people that we normally think about when we talk about MS. Can you tell me a little bit about your roles in this field and also tell me about the work that you presented today at the conference?
Sure.
I
Yeah.
think I think in the early days of MS care, the focus tended to be medical, but what's becoming more apparent now as the research expands is that it's so important to involve all different members of the multidisciplinary team, and a dietitian is part of that team. So looking after the nutritional status and nutrition care of the person who's living with MS.
Mm. The I think the biggest flavor of this conference in particular is wellness, and that seems to be coming through in almost all of the sessions, whether it be clinical courses or symposiums. And wellness, yes, a subjective term, but in MS, it's becoming more and more established of including things like exercise, like speech pathology, and dietetics is a huge one that is coming through. I think if you were to interview us at a conference almost 10 years ago, nutrition would be an establishing area of work in multiple sclerosis. But these days, I think it's a lot more respected as a tool in our toolbox of how we can help improve the lives of people living with MS. So it's rewarding as dietitians to see that, and we're just here to keep fighting for our role and showcasing how dietetics can really improve the lives and management of people with MS.
Yeah, so talk to me about your awesome presentations here at the conference because I'm really interested to find out the impact of your roles on patient outcomes, just understanding the disease.
So, my presentation yesterday was focused on dietary factors relating to multiple sclerosis. So, thinking about risk factors for onset and also progression, but really putting that under the clinical dietitian lens. So, not necessarily looking at it from mechanistic
Mm.
research when you're thinking about nutrients and the impacts on processes they have, but taking a step back and thinking about applying the clinical lens to caring for people with MS. So, I started by I talked about three of the studies that I've been doing as part of my PhD. And the starting point for all of that was doing an online search for dietary advice for MS, because that's where a lot of people who have a new diagnosis start. The
Mm.
first thing they do is think, well, what can I do? The doctor's talking about medications, but is there anything I can do to help my situation and improve my outcomes? So that's a very common starting point. So I conducted a simulation of an online search for dietary advice for MS and identified 17 different eating patterns, and that's what I presented yesterday. Those eating patterns are quite diverse, so they're contradictory, and that can be really confusing for people who are trying to work out what the best diet is.
And increasing
Yeah,
the number of diets that are now being promoted or showcased online creates a lot of confusion.
absolutely, it does. Not only are they contradictory, but some of them can be restrictive as well. So
Mm.
that puts the person who wants to follow that diet at risk of deficiencies. And we don't want that for anybody who's living with multiple sclerosis.
Understandable.